So, welcome to my talk about the glue embolization into varicose vein. First, let's have a look on this video, one of my favorite video by Steve Jobs.
Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs in the square holes, the ones who see things differently. They're not fond of rules, and they have no respect for the status quo. You can quote them, disagree with them, glorify or vilify them. About the only thing you can't do is ignore them, because they change things. They push the human race forward. While some may see them as the crazy ones, we see genius. Because the people who are crazy enough to think they can change the world are the ones who do.
So, there is one important message into video, that always try to think differently, and that is the reason in my last 10 years of practice I have operated more than 10,000 cases of varicose vein. I have done procedure into lots of patients, but still I am willing to do differently to give better and better results to my patients for the varicose veins and other diseases. So, there are different modalities are available to treat the varicose vein, starting from surgery to thermal ablation technique and the foam sclerotherapy. Every technique has some advantage and disadvantage. Surgery and foam sclerotherapy has a high recurrence rate, while the thermal ablation patient has to suffer from post-operative pain for a few days. So, every procedure has some disadvantage, and that is why I am searching for new things for the varicose vein treatment. And in this search I find out the glue embolization for the varicose vein. Glue is not very new for the treating the any diseases. It is used for many diseases like gastric varices, for neurological malformations, and many more diseases for since many years. But for varicose vein, this glue is developed since last 2 to 3 years, and research have already been done on this glue. Right now there are two kind of glues are available into the Indian market. One is a Vinasil and from the Medtronics, and another is from the Invamed vein of glues, and these two glues have very good results for the varicose vein treatment. So, let us see how this glue works. Once we inject the glue inside the lumen of the varicose vein, it will come into contact with the blood and it polymerizes. After that, it occludes the lumen. Mild inflammatory reaction occur inside the lumen, and it leads to the fibrosis and seal the varicose vein lumen, and this is very simple mechanism of action. This is how device look like. This is a gun connecting catheter and the glue. We can fill the glue on this catheter and inject it inside the lesion. So, procedure is very simple. First, map the great sufferance vein, puncture it, put a sheath inside the vein, and then try to pass this catheter of glue inside the vein. Under the Doppler guidance, put the tip of catheter 3 cm proximal to saphenofemoral junctions. Once the system is in place, then start injecting glue inside the lesion. One important thing is a pressure technique. Apply the pressure when the area where the glue is injected for the few time, and this is very important for good results. So, procedure is very simple for glue embolization for the varicose vein, and these are the few pictures pre-op and post-operative shows that very good results obtained after the injection of the glue. For clinical application, glue can we can use the glue in all the indication of the varicose vein, just like saphenofemoral incompetence, saphenopopulate junction incompetence, and also the perforator incompetence. But I use mostly for the moderate incompetency of the varicose vein. I still prefer larger than 10 mm diameter to treat this kind of patient with a thermal ablation. And as I have already discussed the ideal patient for me, right? And advantages are many to use the glue embolization into the varicose vein, but most common disadvantage into the, especially into the India, is the cost. It's very costly compared to laser and radio frequency ablation. Again, if you think differently, then it is always to use the glue embolization for the varicose vein. Thank you.